Polycystic ovarian syndrome is a complex endocrine condition that is a fairly common condition that we see when treating people with infertility. It's a condition that's typically manifest by having lack of ovulation, which most people will figure out by having very irregular menstrual cycles. It's also diagnosed by having hyperandrogenism, which just means an excess amount of male hormones circulating around. A lot of people find out that they have this hyperandrogenism by the fact that they have excess hair growth or problems with hair loss or acne. People who have irregular menstrual cycles, which is the most common presenting symptom, but may also be, some people may also have lack of periods, or some people may just have very heavy, frequent, irregular periods. Now, the problem with excess hair growth, which is called hirsutism, is a common condition of polycystic ovarian syndrome. Some people with polycystic ovarian syndrome, or PCOS, may not have excess hair growth, but still can have the excess amount of male hormones called androgens. This is because even though high levels of androgens in the bloodstream may be circulating, the excess hair growth also is dependent upon the genetic sensitivity of the hair follicle to the male-like hormones. So someone may not be very sensitive to the male-like hormones and may not have excess hair growth, but yet still have the high androgen levels. Typically, PCOS also is associated with obesity. However, not all people with obesity have, not all people with PCOS have obesity. But it is a very common condition that's also associated not only with high androgen levels, but also insulin resistance and a predisposition to having diabetes. PCOS is a very complex condition, and we don't know exactly what precipitates this process to occur. However, we do know that people who are overweight or obese can become more insulin resistant and therefore cause higher levels of insulin, which then can stimulate the ovaries to produce higher levels of male-like hormones called androgens. These androgens can have an adverse effect in terms of follicular growth, and as a result can cause this polycystic ovary condition.